Welcome to The Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone and welcome back to The Hair Loss Show, episode number 82. My name is Dr. Vikram Jayaprakash.
I'm Dr. Russell Knudsen. Welcome.
Welcome back. All right, so today's episode we're going to talk about back onto finasteride. We've talked a lot about finasteride, but specifically we want to talk about the use of finasteride and what are the implications if someone's got pre-existing mental health issues or on antidepressants as well, because we get a lot of questions on that because a lot of people are taking antidepressants as part of their normal medical therapy.
As we've said many times before, there's significant fear about long-term use of finasteride out in the internet, and a lot of it is, in my view, highly exaggerated, and there are literally millions of men around the world using it with no problems whatsoever. We only hear from the people who are having problems. But the commonest side effects are the sexual side effects, but that still is only in 2 to 4% of the population. Once you get past that, you come down to much smaller number of side effects, or as in a percentage. So the one we want to talk about today is, because a recognized side effect is either brain fog or mood alteration, with finasteride, how does that affect people who are using antidepressants or have a history of, shall we say, depressive illness? So the short answer is, in my prescribing of over 20 years of finasteride, the number of people that I've seen that had mood alteration is less than a handful in 22 years. Right? Less than a handful. So that's for people that didn't have a pre-existing tendency towards depressive illness. If they've come in with a past history of depressive illness, then of course we have to be more careful about it. But again, it comes back to what we've talked about many times before, and that's customized dosing. We think, both of us, that most people take too much anyway. And so particularly if we've got people that we believe have got a history of mental disorders or depressive disorders, we're going to be very careful about how we prescribe it, because we know that it has the potential to give mood alteration in a very small percentage of patients. My view is, and we don't have obviously large-scale studies of these things, is that people who are safely and effectively treated with antidepressants, now usually the small dose of finasteride we're putting in the system is not going to have an effect. If people do find that they get mood alteration on finasteride and we withdraw the medicine and they recover, and then we re-challenge them with finasteride and they go back into getting mood alteration, then we're in a catch-22 where we have to decide whether the cure is worse than the disease, because the cure in this situation might be to put them on antidepressants to make sure that they are able to use finasteride, for example. That said, it's not like finasteride is the only game in town, and people can have individual responses to individual medicines. So we may be able to swap it to something else like dutasteride without getting that effect, or go into the stimulatory side, which is the minoxidil laser side of the equation, and accept that we're going to have to use some limitation here in the therapy to make sure that we don't provoke an aggravation of a pre-existing condition.
I think the important thing is to not sort of be binary about it and go, oh, it's either finasteride or nothing, or you just have to suck it up and accept the side effects. No, not at all. Don't think it's acceptable to have any sort of a significant mood alteration if that's been caused by the finasteride. And the key is finding out what that critical dose is for that individual patient that will stabilize them, and what other therapies can we use as well to augment things.
I think it's also worth saying that, again, I have no patients that are in that scenario that I gave them finasteride, they got a depressive mood disorder, they took antidepressants so they could stay on finasteride. I don't have anybody like that in my practice. That's a hypothetical or a theoretical consideration. But it's interesting that because of the tremendous social impact, particularly in young men, that balding can have, how many of them come in either with clinically depressive symptoms or on antidepressant medication. So I can say with confidence that for the patients that came in on antidepressant medication and I was able to put them on to finasteride, I've never had anybody aggravate. There's no interaction, first of all, between finasteride and any of the antidepressants.
So there's no contraindication at all between if you're on an antidepressant or, there's no contraindication to being on
There's
on
no
finasteride.
aggravation of any side effects because of the use of finasteride. And I haven't seen aggravation of their depressive symptoms if they've been effectively controlled on antidepressants. So I think, using just calm judgment and common sense, I think that there's no disqualification for our patients who are on antidepressants to use finasteride. But again, you keep a watchful eye on it and you make sure that you don't let them overdose.
I mean, it sort of raises another point, really, because I'm sure you get this as well. I see this very commonly. And I'm seeing more of it over the last few years, which is, that whole nocebo effect, where someone, they're all, because of what they read on the internet, and this is not just with, mood disorder, but also with sexual dysfunction as well. They're almost primed to getting these side effects. And so, I have had people, I'm sure you have as well, where they come, I've taken one tablet and it's caused me problems across the board. And you go, well, 1 milligram, it just physically, it's virtually impossible to result in those side
I tell my
effects.
patients, if you believe you're going to get a side effect, you probably will.
Yes.
So I think you just have to start with a calm mind and not have fear of it. I mean, I think that, if you go to doctors who are highly experienced and careful, they're going to give you good information about the risks and the benefits of taking medication and discuss it in a calm manner to try and obviate some of these fears that people have.
That's the key. You need to take. It's not something that you need to manage on your own. You need to take advice.
And you
someone
shouldn't alter the dose on your own, because I see this all too
Yes.
often. My patients believe that more is better, so I start them on something and they go, well, I'm getting a bit of a result, but I want a better result, so I'm just going to increase the dose. Mm-hmm. So I think, again, I would just encourage everybody out there to make sure that you clear any changes to your dosing schedule with your treating physician to make sure that everybody's on the same page and knows exactly what's happening. Because if you report a side effect, we need to know whether that's something that just developed by itself or it developed because you changed something. That's an important consideration. But nonetheless, people with a history of depressive disorder or people on antidepressants are not contraindicated to use finasteride, but if they do react to finasteride, there's no reason they can't try something else.
Excellent. I think that covers the topic. Fantastic.
All right. Hope that helped.
Thanks very much. See you next episode. Take care.
Cheers.